All right, welcome to another deep dive. This time we're going to be talking all about healthcare in 2025, specifically all the tech that's shaking things up.
Yeah, it's a wild world out there, and we've got some great sources to pull from today.
That's right. We've got Health Populi, Healthcare Dive.
Oh, and Kevin MD, The Atlantic.
We've even got some Becker's Hospital review in there.
It's going to be a fun one, folks. Lots to unpack.
Yeah, it feels like healthcare is kind of at this crossroads.
Yeah.
I mean, technology is playing such a huge role, bigger than ever before.
Right. Like, it's almost everywhere you look.
Exactly. Like, take AI, for example.
Yeah, AI.
It seems like it's just exploding right now.
It is.
But is it really living up to all the hype?
Well, I think we have to remember that AI is a tool, right? Like any tool, it can be used for good or
not so good.
Exactly.
Yeah.
But there are some really amazing things happening with AI in healthcare.
Like what?
Well, like this story about Orlando Health, they're using AI to literally save lives.
Yo.
Yeah. They've got this platform called Viz AI that analyzes, stroke patient images. And get this,
What?
it sends them right to the specialist's phones.
No way.
Yeah. So they can get treatment started way faster.
I mean, in those situations where every second counts, that's got to be, huge.
It's a game changer.
Yeah.
When you think about it.
So this is mainly being used for diagnostics then, right?
Yeah. A lot of the focus right now is on using AI for things like analyzing medical images and stuff.
Gotcha. So kind of helping doctors make decisions, maybe even more personalized decisions about treatments.
Absolutely. AI is being explored for everything. I mean, from predicting how a patient will respond to a certain drug
Wow.
to, coming up with entirely new treatment approaches.
That's incredible. But, there's always two sides to every coin, right? We hear all this amazing stuff. But I'm also curious about, what are the red flags with AI in healthcare?
Well, one thing that keeps coming up is the potential for bias in AI systems. If the data that's used to train the AI is biased in some way.
It'll just, perpetuate those biases.
Exactly. And a study in Health Affairs pointed out that not all hospitals are doing a good job of consistently checking for this bias.
So you're saying they're, not evaluating those AI tools rigorously enough?
Yeah, and that's a huge problem, right? Because if these tools are being used to make important decisions about patient care, we need to know that they're fair and accurate for everyone, not just for certain groups.
For sure. It's not just about the tech. It's about, the people using it.
It's the implementation. Exactly.
Okay, well, speaking of big moves, I read that Sutter Health just shelled out a cool $1 billion for an AI imaging deal with GE Healthcare.
Yeah, that deal was huge news.
What's your take on that?
Well, I think it shows how seriously these big healthcare players are taking AI.
Yeah.
I mean, they're putting their money where their mouth is.
Right. It makes you wonder, though, are we headed for, an AI arms race?
Totally. Will everyone be scrambling to get the newest AI tech? And at what cost?
Yeah. And then you've got, all these smaller startups coming in doing amazing work with AI. It's kind of like, David and Goliath.
Oh, for sure. And then throw the political stuff on top of that.
Right. Politics.
I mean, the current administration has their whole AI strategic plan, but who knows what'll happen when President Trump takes office?
Yeah, it's a wild card. It feels like we're moving into this world where, our homes are becoming healthcare hubs.
Totally. I mean, CES 2025 is whoa.
Seriously.
Gadgets and gizmos galore, all promising to, turn our homes into these health monitoring centers.
Like what kinds of things?
Well, one thing that really stood out was this Withings ONIA smart mirror.
A smart mirror.
Yeah. So imagine this. You're brushing your teeth.
Okay.
And your mirror's giving you a rundown of your sleep quality, heart rate, even your weight, all that data pulled from your phone and stuff.
Okay, hold on. That sounds pretty futuristic, but it also sounds like a potential privacy nightmare.
Oh, 100%. And that's something that, developers of these technologies really need to be upfront about.
How are they protecting our data?
Right. But even if we solve the privacy issue, there's still the whole problem of interoperability.
Enter what now?
Interoperability. Basically, it means getting all these different devices and systems to, talk to each other.
Oh, right, right. So if my smart scale and my smartwatch aren't communicating.
Then you're not really getting a complete picture of your health.
Uh,
It's like having pieces of a puzzle, but you don't know how to put them together.
yeah, that makes sense.
But there's some good news on that front. Validic, they announced that they're working on getting wearable data to go straight into EHRs.
Wait, hold up. EHRs.
Yeah, yeah. Electronic health records.
Right.
Basically, those are, digital versions of patient charts.
Oh, okay, okay.
And the idea is that, like, your smartwatch could be feeding data straight into your medical record.
So, like, your doctor could see, not just your blood pressure from that one appointment.
But, like, how your activity and sleep have been trending for months.
So we're talking about way more data and, like, a more complete picture of someone's health.
Exactly. It's about moving towards, like, continuous care.
Not just, like, episodic visits when something's wrong.
Right. So if all this cool tech's going to be at home, does that mean we'll rely less on the, expensive healthcare system?
That's the million-dollar question, isn't it?
It is. And I don't think anyone knows the answer for sure yet. But it's definitely something to watch, especially since, we're hearing so much about hospitals facing financial pressure.
Yeah, there were some pretty concerning reports, right? Like credit agencies downgrading outlook for, like, a bunch of health systems.
Right. And then you've got legal battles over Medicare payments.
Plus, that whole threat to the 340B drug pricing program, it's like everything's hitting hospitals all at once.
It's a lot. And unfortunately, all that financial pressure, it's going to trickle down to the patients.
In what way?
Well, you could see things like longer wait times, fewer services,
Yeah.
Maybe even staff shortages.
Yeah, if hospitals have to cut costs, they're going to cut staff,
Yeah.
right?
Sadly, that's usually what happens.
Wow, so it feels like the healthcare system is just getting squeezed from all sides.
It is. It's tough. But, even with all these challenges, there's still so much innovation happening.
Like what?
Well, like we were talking about with AI, the way hospitals are using it to improve care,
Right.
and then all this cool tech for home health care, that's pretty amazing.
It is.
And honestly, the healthcare professionals themselves, they're amazing. They're the ones on the front lines working tirelessly to make sure people get the care they need. It's inspiring, really.
It is. It's easy to get caught up in, like, all the doom and gloom, but,
Right.
there are still people out there who really, really care, and they're making a difference.
Absolutely. They're the heart of it all.
Well, speaking of heart, did you see that Gallup poll about, like, the most ethical professions?
Oh, yeah, yeah. I think I know where you're going with this.
Nurses. They came out on top again,
They
right?
did. They always score so high for, like, honesty and ethics.
I mean, it makes sense. They're literally caring for people at their most vulnerable moment.
Exactly. They're incredible. But there's also this really worrying trend emerging.
What's that?
Nurse burnout.
Oh, man. But nurses are known for their resilience.
They are, but even the strongest people have their limits.
Right.
And this McKinsey study found that, like, over 50% of nurses are reporting burnout symptoms.
Wow, that's a lot.
It is.
Yeah.
And some are even considering leaving direct patient care altogether.
That's really scary. I mean, if we lose those experienced nurses, that's a huge blow to the whole system.
Right. And it makes you wonder, can all this technology we've been talking about, actually help prevent this burnout?
Or is it just going to, like, add another layer of complexity to an already difficult job? And on a completely different note, it's National Clean Your Desk Day, apparently.
Oh, yeah. Maybe we should all take a minute to tidy up.
Well, while we're at it, let's not forget about good old-fashioned hand washing.
Oh, right. The basics.
Because even in this world of AI and smart mirrors,
Hand washing still matters.
big time. A study in The Atlantic found that soap is actually still the best way to fight those, nasty stomach bugs.
Yeah. So move over. Hand sanitizer.
Right. Soap is still king.
It's so easy to get caught up in all the fancy new stuff, but
Sometimes the simple things are still the most effective.
absolutely.
And especially now, with all these respiratory illnesses going around,
Flu, RSV, COVID.
hand washing is more important than ever.
It's true. It's like your first line of defense.
Exactly.
It really is. Like sometimes
Uh-huh.
we forget about the simple stuff.
Right. Back to basics. But, we were talking about all the exciting stuff happening with AI and diagnostics. Like, where do you see that going in the future?
Oh, man. AI and diagnostics is just getting started, really.
Okay, so what's next then?
I think we're going to see AI getting even better at analyzing medical images, like way more accurately than humans,
Wow.
and then predicting patient outcomes. Like, okay, imagine this. You go to the doctor, and they can tell you with pretty high certainty how you'll respond to different treatment options.
So like personalized medicine, but on a whole other level.
Exactly. And I think that's where it's all headed. More personalized medicine thanks to AI. Like there was this really cool partnership announced between Cerebral Systems and the Mayo Clinic.
Okay, those are some big names. What are they up to?
They created this genomic model. It uses AI to predict the best treatments for rheumatoid arthritis.
Wow. So instead of the, one-size-fits-all approach,
They can actually tailor treatments to each patient's individual genetic makeup.
that's incredible. But like we were talking about earlier, we got to make sure all this AI stuff is done responsibly, right?
Oh, 100%. We can't just throw AI at every problem and expect it to magically fix everything.
Right. We still need those human checks and balances.
For sure. We need to make sure it's being used ethically, that it's not biased against certain groups of people.
Yeah. And we need to understand, how it's actually impacting patient care.
Absolutely. It's not just about the technology itself.
So we've talked about AI in hospitals, AI for diagnostics, but I'm also curious about, how AI and all that home-based care stuff we were discussing, how do you see those two things intersecting?
Oh, that's a great question. I think those lines are going to get super blurry in the future. What's hospital care and what's home care?
Right.
I mean, as AI gets smarter and we have more data at our fingertips, I think we're going to be managing a lot more of our health from home.
Okay, so paint me a picture. What does that look like?
Well, imagine you're having a virtual checkup with your doctor,
Okay.
but it's not just a phone call or whatever. You're actually doing it through your smart mirror.
My smart mirror. Okay.
And while you're talking to the doc, your smart fridge is reminding you to take your meds
Wow.
and maybe even suggesting some recipes that are good for your blood sugar.
It's like having a whole medical team just built into your house.
Right. And think about all the data your wearables are collecting. Sleep, activity, heart rate, all that stuff.
So much data.
It's crazy. And it all feeds into this super comprehensive picture of your health. Both you and your doctor have access to it.
Okay, that does sound amazing, but I mean,
Yeah.
it also feels a little impersonal maybe. Are we going to lose that human connection in healthcare?
That's a really good point and something we have to be careful about. I mean, technology shouldn't replace human interaction entirely.
It's about finding that balance, right?
Exactly. Technology should be there to enhance those human connections, not eliminate them. And it should make things easier for both patients and healthcare providers.
Yeah, I guess that's the key. Make things better, not just more complicated.
Right. And another thing to think about is accessibility. We're talking about all this fancy technology,
Right.
but not everyone can afford a smart fridge or a super high-tech wearable, and a lot of people still don't have reliable internet access.
So how do we make sure all these advancements are actually benefiting everyone?
That's the million-dollar question, and it's going to take a lot of effort from, policymakers and healthcare providers.
Tech companies too, probably.
Definitely. We have to be really mindful about not making those existing inequalities even worse.
Yeah. That's a lot to think about.
It is. But you know what? It's also a really exciting time to be alive.
How so?
Well, think about it. We're literally on the cusp of a healthcare revolution.
Okay, I like the way you think.
Right. I mean, who knows what amazing breakthroughs are just around the corner.
It's true. It's true. But let's not get too carried away. We still have those, less glamorous issues to deal with. Remember all that stuff about nurse burnout?
Oh, yeah, that's a big one. It's pretty disheartening, honestly.
Yeah. I mean, here we are talking about all this amazing technology and, the future of healthcare.
Mm-hmm.
But the people who are actually delivering that care are struggling. It's kind of like,
And it's a disconnect. It really highlights the need for a more holistic approach to healthcare, you know? One that takes care of the caregivers, too.
absolutely. We need to be supporting our nurses, giving them the resources they need.
Making sure they feel valued and appreciated.
Yeah, because they're the backbone of the whole system, really.
They are. Without them, none of this other stuff matters.
This deep dive has been so insightful.
It
We
has.
covered so much. AI, home healthcare, financial pressures.
Hand washing?
Oh, yeah. Got to wash those hands. It's a lot to process.
It is. But it feels like, we're just scratching the surface here.
Right. There's so much more to explore.
Totally. Healthcare is this constantly evolving thing,
But before we get too deep down the rabbit hole, I want to leave you with a question.
Okay, hit me.
So we've talked about all these trends. AI, the shift toward home-based care, hospitals struggling to stay afloat.
Yeah, it's a lot.
What do you think, 5 years from now, what will the healthcare landscape look like? Will we actually see this big shift toward preventative care, personalized medicine? Will technology really change everything?
Ooh, that's a tough one. I mean, it's impossible to predict the future with like 100% certainty.
Of course, of course.
But I think it's safe to say that, yeah, preventative care and personalized medicine will be huge, and technology will definitely play a bigger and bigger role. But you know what? I
Right.
think that human touch will still be there. It has to be.
Right. At the end of the day, it's still about people caring for people.
Exactly. And I think patients are going to become more and more empowered too.
That's
They'll have access to more data, more tools, more options. It's like you're not just passively receiving care anymore.
You're an active participant in your own health journey.
Right. You're in the driver's seat.
I like that. It sounds like we're on the verge of something big.
I think we are. It's going to be wild.
Well, on that note, I think it's time to wrap up this deep dive for now.
Already. Man, time flies when you're talking healthcare.
It really does. But I hope this has given you, some food for thought.
For sure. Lots to chew on.
And I hope you'll join us again for another deep dive soon. In the meantime,
Stay curious.
and keep learning. It feels like we're standing on the edge of something really big in healthcare.
Yeah, like a whole new world is opening up, but we're not quite sure what it looks like yet.
Exactly. And it's exciting, but also kind of scary,
Totally. It's like we're so used to doing things a certain way in healthcare, and now everything's changing so fast.
Yeah. And even with all this tech talk, it seems like those basic things like having a good relationship with your nurse
Oh, absolutely. That human connection will always be important.
and washing your hands. We can't forget about the simple stuff.
Never underestimate the power of soap and water. But you're right, it's all about finding that balance between the high tech and the low tech. We need both.
This deep dive has given me a lot to think about.
Me too.
Oh.
It's been quite a journey. We've covered so much ground: AI, home health care, the financial struggles of hospitals, the importance of nurses. It's a lot to digest.
It really is. But hey, that's what these deep dives are all about, right?
Right. Diving deep, exploring new ideas, challenging our assumptions.
And hopefully coming away with a better understanding of this crazy world we live in.
Absolutely. And I think, even though we've covered a ton of ground, this is really just the beginning of the conversation.
It is. Healthcare is constantly changing. There's always something new to learn, something new to explore.
So stay curious, folks,
Keep asking questions,
and don't be afraid to challenge the status quo.
because at the end of the day, it's all about creating a healthcare system that works for everyone.
That's the goal.
Well, on that note, I think it's time to wrap up this deep dive. It's been a pleasure exploring these topics with you.
The pleasure was all mine. It's been a great conversation.
And remember, this is just the beginning. There's so much more to learn and discover about the future of healthcare.
So stay tuned, folks.
And until next time, stay healthy and stay curious.